the hair rejuvenation, I guess, with the Fotona I gained.
Yes. So now we are going to be talking about the hair restart or restoration.
Beautiful.
Perfect. So this is actually, I just would like to emphasize that regarding the hair restoration with the laser, it is something I did not believe in. I thought, how come that we are using the laser in order to remove hair, and then we are using the laser to restore the hair? So it seems that we are doing acrobat. But I started to see some reports from colleagues, which are really very encouraging. And there is a scientific rationale behind. Of course, here we are going to be using the erbium YAG, not the Nd:YAG. The Nd:YAG we're using to remove hair, and then the erbium YAG we are removing to restore. We are using to restore the hair. So it's really nice paradox. Now, when we talk about the laser-assisted hair restoration, it's very important to hit a little bit the basics. So it's important to remember that hair loss occur in more than 60% of men and in about 10% of women. For millions of individuals, hair loss is a major problem associated with loss of self-esteem, insecurity, and even sometimes depression. Hair loss can range from early thinning of hairline recession to complete loss of hair along the top and upper sides of the head. For thinning of the hair, for thinning to become cosmetically noticeable, at least 50% of the hairs must have fallen out in a particular area. Loss of a smaller percentage than this generally does not result in cosmetic appearance of hair loss. In addition to the loss of number of hairs, the hair loss process causes individual hairs to thin, which further contribute to the appearance of hair loss. For women, the development of androgenic alopecia is classified into 3 stages. The typical pattern of hair loss in women is progressive diffuse thinning in an oval area along the top of the scalp. Hair loss along the hairline is usually spared. In women, most hair loss is genetic, although women have an increased incidence of hair loss caused by medical conditions as hormonal imbalance, trichotillomania, and post-stress telogen effluvium. Interestingly, even with androgenetic alopecia in women, there appears to be an additional inflammatory contribution to hair loss, as scalp biopsies often reveal a localization of lymphocytic folliculitis around the stem cell containing bulge region of the hair follicle. As with male pattern baldness, female pattern androgenic hair loss is progressive. It increases with time. It is very important to be suspicious with suspicion of androgen excess if the following are present: hirsutism, which means hair distribution in the face with male pattern in females; menstrual disorders; cystic acne; galactorrhea; virilization with temporal recession; lowering of voice, pitch; increase in muscle mass, especially the shoulder girdle; and infertility. So those are signs that there is something wrong with the androgen. So this is just showing us a diagram about manifestations of excess androgen. So we get thinning of the hair on the head, hirsutism, acne, weight gain in midsection of the body, high cholesterol level, high blood pressure, polycystic ovarian syndrome, ovarian tumors, high sex drive, deepening of the voice, irregular or absent periods, and pre-diabetes, type 2 diabetes, and blood sugar issues. So all those are signs of excess androgen. And if we have any of them, we have to make a full endocrinological assessment to diagnose the problem. Hair loss in women can be caused also by hypothyroidism. Various medications can cause that, systemic disorders, trauma, whether it's surgical, burn, or any other kind of trauma to the scalp, and some infections also can damage and destroy the hair follicles. Now, one of the treatments for the hair loss is the light therapy. And besides, of course, all other types of therapy, which is not the topic of today. Today we are focusing on the light therapy and the laser in particular, but the majority of studies found an overall improvement in hair regrowth, thickness, and patient satisfaction following the low-level light therapy, LLT or the LED, light emitting diode therapy. Further controlled randomized clinical studies are required to establish the efficacy of these devices. Today, I think we know that there are so many devices in the market, even home use, to stimulate the hair growth. However, what I would like to emphasize is that if there is any systemic disease, those treatments are not going to be enough. We have to fix any systemic problem. Otherwise, our treatment is never going to be optimum or complete. Now, when we talk about hair restoration overview with the Fotona, we have three options for the hair restoration. We have the erbium YAG hair transplantation, where we are able to, the recipient site, to open a hole in order to have the implantation of the hair into the scalp. Then we have the fractional ablative erbium YAG microwinding of the scalp as a method of transcutaneous delivery of medications, as we are going to see. And then finally, and this is the most recent one, is a treatment they called hair restart, as the night laze treatment of the snoring, or the anti-malaise treatment of vaginal tightening, or the incontinence treatment of the stress-free incontinence, or the smooth eye treatment for the periocular rejuvenation. They have the restart, hair restart, as a non-ablative fractional erbium YAG in order to stimulate the hair growth. Those are the different options which we can achieve with the erbium YAG of Fotona. And regarding this ablative, the hair transplantation, they have patented a handpiece, particular handpiece, and a technique in order to make the opening for the hair transplantation recipient area in order to be able to have very good site for the implantation of the hair follicles in the hair transplantation. And actually, having the erbium YAG is an excellent option because we are able to have the hole with very well preserved vascularity. Because, you know, if you are using the holes with the CO2, then the coagulation occurring is going to damage the vascularity at the periphery of the wound. If you are doing it with a scalpel, then there is no control of the bleeding at all. So the too much bleeding at that site will might prevent the implantation. However, when this is done in a controlled way with the erbium YAG, this will have a very good media for the hair transplantation, because there will be vascularity, not too much blood, not too less blood. So this is going to be an excellent medium for that. And this is a technique which has been described in literature. We are creating 1 millimeter holes in the scalp with the variable square pulse erbium YAG, as we can see in this photo, the small holes in order to get the hair implanted into that hole. And this is the result, where we can see that the percentage of hair implanted is much higher with this technique. And this might be a very good development in the hair transplantation world. The second option with the erbium YAG of Fotona is to use the fractional ablative erbium YAG microwinding for the scalp, where we are using the FS01 or the FS02 handpiece in order to create the small micro holes, which is the fractional ablative erbium YAG. And then we apply the topicals, whether it's triamcinolone or Propecia solution, which is going to increase the absorption. And this is a method of transcutaneous delivery of medications, which has been reported in different indications. But one of them definitely is the hair regrowth, where we are doing this fractional erbium YAG and then apply the topical ingredient immediately. And we can see that the situation improved 45 days very significantly. And then after 4 months, it is really much better. In this comparative study, the fractional laser was done by itself, and then the fractional laser with the triamcinolone was done on the other side. I don't think there is major difference, maybe a little bit more on the side of the triamcinolone along with the erbium YAG fractional. However, in both sides, there was significant improvement after 4 months. And this is another patient with the fractional erbium YAG by itself. So this is before, and we can see the distance. And then after 45 days, it is much better. And after 4 months, it is significantly better. Another patient, a combination of fractional erbium YAG and the triamcinolone, 3 sessions. And after 2 months, we can see the improvement in the scalp and in the hair growth. The same patient, and we can see the area of baldness, which diminished significantly, 3 centimeters instead of 5 centimeters. And this is after 2 months. And I think this is considered very good result. Now, this is the dermoscope, and we are able to see the fractional pulses on the scalp with the dermoscope for treatment of alopecia areata. The spot size here is 7 millimeter. The handpiece used was the PS02. The power was 3 watt, and we did stacking, 4 stacking per site. So this was the protocol, and we can see the improvement. There was a topical Propecia gel applied with the erbium YAG fractional ablative pulses, and we can see the significant improvement. Another patient, and we can see also very nice improvement. Now, what is the third option with the erbium YAG? This is the most recent application, and I think it is really very nice because it's associated with no pain. It's a very simple technique, and the results reported are definitely very exciting. What I would like to stress on is that there is no magic here. If there is any systemic cause of hair fall, this has to be dealt with and treated in parallel to the laser treatment. The laser treatment is not going to work by itself if there is systemic cause of hair fall. So this is the advantage of this technique, the hair restart, the prevention of further hair loss, increase the hair density and thickness. It is non-invasive, no medications are required, and no downtime is reported. The proposed mechanism of action includes dual mechanism of tissue hyperthermia, slow and fast, enhanced vasodilatation, and activation of neoangiogenesis. An increase in the heat shock protein expression activates fibroblasts, producing new collagen and forming the extracellular matrix, which is going to improve the viability of the hair follicles. The results include improved vascularization of hair follicles, activation of keratinocytes and dermal papilla cells, thus reducing a decrease in hair follicle size and promoting the growth of new follicles, prevention of further hair loss, and increase of hair density and thickness. The parameters used are the PS03 or PS03X, depending on the model of the system you are having. We are using the Fotona Smooth Pulse, 7 millimeter spot, 7.75 joule per centimeter square, and it is the highest repetition rate in this mode, which is 3.3 hertz. We are going to be dividing the area into 3 or 4 equal areas, uniform brushing or painting until constant warm or hot hotness is achieved, but not burning feeling reported. And this is something which should continue for 4 to 5 minutes on each of the areas. So this is the protocol. There are many reports which I'm going to just present from all over the world. So this is Jeff from the US who is working with Fotona, and he tried it on himself. So this was in December 2017, and then almost 1.5 months later in January, and we can see the hair density increased. So I think this is something which is outstanding, and continuing to do that. His hair is now much better than when he started the procedure. Some other people from other parts of the world are reporting the same improvement, and the pattern is almost very reproducible. So we can see that this is something which has been reported by different people in different places in the world with different patients. And we can see the increase in the density of the hair with this simple technique. Another patient from Turkey. And this is in 2 sessions, and we can see the improvement. And then the improvement is going to continue with the subsequent sessions. So, and this is Dr. Doris Day from the US, who treated alopecia universalis with this technique. And I think we can see the result. It is really outstanding, and it might be a very nice step forward in the treatment of hair fall and the alopecia. This is after 3 sessions, and again we can see the increased density in the hair, something we could not have achieved with different methods. This is from Taiwan, and again we can see the difference in the hair density in that patient. And this was someone who's reporting her first case result. And people are really very happy when they see such nice improvement with a technique which is associated with no pain and no complications. The reports continue to be sent out, and we can see the difference in different patients from all over the world. I was very skeptical about this treatment because I know that people who are having hair loss are usually over-expecting, and they would complain that it was not up to their expectations. However, when we see that within 4 treatments with no supplements, so this was a monotherapy, we are able to improve the hair that way. This is something to be really considered. Even in Japan, there are many reports, and in Japan, the hair fall is a big issue and they don't like it. So when we get some reports from there and it goes into the magazines and so on, it tells us something. So this is another patient with the same technique, with the same protocol, and we can see the significant improvement in the hair. So where are we now? As I said, there are some publications about this procedure, and we definitely need to achieve angiogenesis. We need to achieve androgen antagonism, vasodilatation. We need to improve the potassium channel opening mechanism and 5-alpha reductase inhibition. And those are the strategic or the therapeutic strategies in order to deal with the hair growth and hair rejuvenation. So with this technique, we are able to achieve angiogenesis and the vasodilatation, which are 2 targets in the pathogenesis of the hair fall. Of course, in many cases, it shouldn't be a monotherapy. We have to combine that with other techniques and other treatments in order to deal with the other areas of the pathogenesis of the hair fall and androgenic alopecia. This was a lecture in the Laser and Health Academy symposium organized by Fotona in 2019, just before the corona. And we had a great speaker, and I think it was one of the most interesting talks in that symposium, where she was presenting her experience, Dr. Cheng, and she was reporting 2 weeks, 2 sessions, and the improvement in the hair in different patients within 2 sessions. And we can see the result, which was really very nice, very impressive. And this was very encouraging in order to try the protocol and start to offer this service. Of course, it's very important to let the patient know that if there is any underlying pathology or systemic pathology, it has to be dealt with effectively. And the conclusion of her study was that the Erbium YAG laser is effective and safe in inducing vellus hair growth in Asian at low fluence, significant hair growth, and no need for anesthesia or painkiller during the procedure. It is very tolerable and associated with no significant pain. Potential induction of acute urticaria need to convey to patients, but it is short-lived and easily manageable with antihistamines. So some patients, per her report, reported that some patients had some urticaria reaction or allergic reaction, maybe from the heat. And I think that those are patients who are having cholinergic urticaria, and any heat can cause that. It is not particular to the laser. And if that happened, of course, it is very easy to use antihistamines without any problem. And here, this is the link for her talk in the Laser and Health Academy meeting. And this is another treatment report about a treatment result where this hair restart was used in combination with the minoxidil, 5% minoxidil. And this is the outcome, which is really very significant. Another patient, and we can see very nice result. And another patient after 2 months, and then after 5 months of treatment. After the initial 4 sessions, we can do maintenance, which can be done every 3 or 4 months, 1 session, in order to maintain the hair in good shape. Regarding the future application development, we might need still to further optimize the protocol with eStart and launching more studies to prove efficacy and safety of these treatment modalities. So I think with this, we end the presentation, and I'm open for any questions or comments you might have. But this is, from my point of view, a revolutionary treatment for the hair fall, and it might improve our results in dealing with hair fall in the field of dermatology and cosmetic dermatology. So any questions?
Perfect, perfect. Any questions? I have a question for me. When I come for a snoring treatment next time, can I do the same for my hair? That's my question.
Of course.
Okay, there you go. My problem solved.
We can do a bundle treatment.
So I have 3 major problems. 1 is the snoring. 2 is the hair restoration. And then number 3 is my rosacea. All 3 of them, the control is on your hand. So then I'm gonna come in 1 session.
we need to do a package deal for you, Dr. Mohsen.
The package. Perfect. Perfect. Okay. Dr. Polio is asking, is there an inflammatory alopecia? If there is an inflammatory alopecia,
I think this is not a good indication, because if there's any inflammatory process, we don't want to use the laser, which is causing some sort of acute inflammation. So I would prefer that we do control of any inflammatory process with the appropriate treatment, not the laser. The laser is contraindicated whenever there is an inflammatory process going on, or infectious process going on, of course.
Perfect. I see Dr. Labib is asking how many times we need to start as a starter, I'm assuming.
Yeah, we need to do 4 sessions, 2 weeks apart. And each session is going to be with the same protocol, where we are using the PS03. We are going to be using 7.75 joule per centimeter square, smooth pulse, 3.3 hertz. And we do multiple passes for 4 or 5 minutes on each of the squares. And that's it. So the initial protocol was 3 passes. But then I think now we need to let the patient feel some heat, tolerable heat. I would like to see some erythema, and then I move to another square, 4 sessions, 2 weeks apart.
Very good. I don't see any other questions.
Okay.
No, I don't see. Oh, there is more questions coming up. Okay. Dr. Ala, is the patient with psoriasis or immunosuppressive disease related to hair? I'm assuming immunosystem disease, not suppressive, related to hair, can do such a procedure.
Regarding psoriasis in particular, it is as with vitiligo, as with lichen planus. Any disease which might have Koebner phenomena, if the patient is having Koebner phenomena or history of Koebnerization, then the laser in general is contraindicated. because laser is considered as a trauma, and any trauma might induce new lesions. So it's contraindicated to use lasers in a patient who is having Koebner phenomenon. Now, if the patient is having scalp psoriasis, and the psoriasis is active, of course, this is a contraindication. We cannot treat an inflammatory skin lesion with this kind of protocol. If the situation is under control and there is no lesion, there is no active lesion, and the patient is not having any Koebner phenomena, then why not? We can use that technique in order to improve the hair in that patient.
Causing new lesions or causing reactivation of the disease?
Reactivation of the disease is going to happen with the development of new lesions. So this is the Koebner phenomena, where if the patient is traumatized, they are going to get new lesion of psoriasis, or new lesion of vitiligo, or new lesion of lichen planus. So this is the Koebner phenomenon. And as laser is considered as a kind of trauma, we can enhance the occurrence and the appearance of new lesions in the site of the laser treatment. Someone might have psoriasis, and he has psoriasis in certain patches in the body, but then if you treat them with laser hair removal, for example, they can develop new patches of psoriasis in the area you treated. Or if they get traumatized in a certain area, they can develop a new lesion of psoriasis. This is called Koebner phenomenon.
Okay, not the psoriasis, because that just came to my mind because we had a patient, I'm in Vancouver now, we have a course here. 3 days ago, we had a patient came with the discoid lupus.
Yes.
And she had the lesions on the scalp, but we had a PRP class. She was asking if I want to do, but right now there was no active lesion. So she said, if you do PRP, can I do the PRP or not? Now my question is, can we do laser for this patient or not?
Yeah.
But you can answer, also PRP you can answer. Can we do PRP or not?
Yeah, of course you can. It's not a problem at all. Discoid lupus can be treated with pulsed dye laser. It is not an issue. It can be treated with certain types of laser. So it is not an issue, but the most important thing is to take the appropriate history. It's very important to make sure that the patient is not developing Koebner phenomena and new lesions on the trauma. This is the bottom line.
Either laser or PRP or anything.
Yeah,
okay.
Yes.
Perfect. I think I see more questions. For patients with protein or creatine hair treatment, should they have such a procedure?
Yeah, there is no problem at all, because we are not treating actually the hair shaft itself, which is being treated with those techniques. We are treating the scalp. So we are treating the hair follicles. So there is no issue, but we have to know that some patients are having very brittle hair, and the hair is being impacted negatively with those procedures if they are not done properly. So this is something which we have to communicate with the patient, regardless the procedure we are going to do. But those are not a contraindication for such a procedure.
Beautiful. Perfect. I don't see any other question. Thank you so much. Yes.
There is a question on the chat.
Dr. Labib.
Yeah, if we have alopecia areata. Yeah, of course, alopecia areata is a nice indication, but in this case, I might do the fractional erbium YAG, not the restart, because with the fractional erbium YAG, I can do that, and I can do the minoxidil topical in order to increase the transcutaneous delivery, and it might be a better option. So this might be a better option. If you don't want to go for the fractional, then you can use that. However, I believe the fractional along with the topical minoxidil or the triamcinolone might be a better option in these cases.
Perfect. Any other question do you see, or in chat, anything, Dr. Badawi? I don't see anything else.
No, my last comment is something I would like to add, because many people are not aware of this fact. One of the causes of hair fall is errors of refraction. Many people are not aware of that. So I would like just to take the opportunity to highlight the fact that any person who is complaining of hair fall one of the things which has to be done along with so many other investigations is to check the eye site, because if there is any errors of refraction, then it has to be corrected. Otherwise, the hair fall is going to continue to happen and increase. The rationale behind that is that when we have a refractive error, then the muscles holding the lens is in continuous contraction in order to get the image on the retina. And when that happens, the muscles of the lens, of the eye lens, is consuming 10 times more blood than in other scenarios. And when that happens, then this blood is withdrawn from the blood going to the hair follicles. So the perfusion of the hair follicles is going to be diminished, and this is going to lead to hair fall. So refractive errors are causing hair fall, and this is something to be checked and to be corrected in order to decrease the hair fall.
Wow, this is very interesting point.
Yeah.
So who did find out about this? Like, how did he find out? Just by accident?
It is something which is I was discussing with some observations with some of the ophthalmology colleagues, and actually it was very astonishing to correlate that with some live examples. Many people who are having some, the blood supply is not optimum. When they eat, they feel cold extremities. Do you know anyone with this criteria, Dr. Mohsen?
So you mean anytime they eat food, they feel like cold fingers?
Yeah.
And feet as well, or only hand?
Sorry?
Feet as well, or only hands?
The extremities in general.
Terminal.
Yeah, terminal. And the explanation for that is that when we eat, our stomach is consuming, it needs a lot of blood, which is going to be, withdrawn from the periphery. And that's why it is easy for some people to feel cold extremities. So
that's the job of parasympathetic system, actually,
exactly.
To divert the blood to the
exactly.
digestive system. That's what happens during the night as well, at night when you're sleeping.
Yeah, exactly. But
that's
it's not
usually noticeable, like somebody doesn't complain of that. But again, you're saying some people is extreme, right?
It is an observation that many people who, when they eat, they feel cold extremities, regarding how it happens, but the blood is withdrawn towards the stomach in order to do its function. The same mechanism when we have a refractive error and the muscles of the lens controlling the lens of the eye is always in continuous contraction. It consumes a lot of blood, and this is going to affect the blood perfusion in the hair follicles. So
how they treat that? Usually with glasses, they need a glass.
Yeah, of course. Yeah, if you are using lens or the appropriate glasses, then
so the muscles,
the muscles, of course, the muscles are going to be relaxed. It's
very
not
interesting
strain.
Point.
It is not strain, and the hair fall will decrease.
Very interesting point. I think because all of them, they get the blood circulation from the branches of internal carotid artery, so then it's just a common branch, right? So,
exactly.
And then the lens is before hair.
Yeah.
So then they will get all the blood, the first station, and then there's nothing left for the next station.
Exactly.
See, that was my problem, Dr. Badawi. So I need glasses. There you go.
See?
I need glasses.
Next time I see you after the glasses, you will grow hair.
That's perfect. Okay then. Okay, so is the Amanda is asking, is the presentation that was supposed to start at 2:15, the hair rest?
Okay.
I think we started back to back because Dr. Badawi was here. Sorry, probably we just started a little bit early. You're right. So what we do, we would, if this is recorded, we will just put it on a platform, Amanda. Sorry about that.
Okay.
I think we started a little bit earlier. Oh, there is another question Dr. Polio is asking.
Yes.
I think alopecia areata you just answered about alopecia Barbie for the beard. I think that's the one, right?
Yeah. The same happens, and we can use either the hair restart or the fractional along with the minoxidil. Do we need laser or no? I think we have to go the classic way. So I would start with the topical corticosteroid cream for 3 weeks and see if it doesn't respond. Then we have to do the laser intervention.
Perfect. Okay, then. Any other question? Amanda, sorry again about that, because we were thinking everyone is on the both presentations back to back, and Dr. Badawi was here. We just started right after answering the questions. As I said, this is fully recorded, and then you will see. We just record also the Q&A, so you would just be able to watch the Q&A as well, probably the next 2 to 3 days. And then that's it. Thank you so much, Dr. Badawi.
I just would like to highlight that for Amanda and for anyone else, if there are any questions related to the talk of yesterday, the 4D, or those 2 talks, please send them to the Canadian Board of Aesthetic Medicine. And please, Dr. Mohsen, forward any questions you might receive to me, and I'll be very happy to answer them as soon as possible. And once again, I would like to encourage everyone to become member of the Canadian Board of Aesthetic Medicine. We are together trying to always improve the content and help everyone in order to, master the field of cosmetic and aesthetic medicine, which is really very important, because if we do a better job, then everyone is going to be happy and the field is going to be much improved. Yeah.
Improved and safer. Yeah, I will share. We will share the email of all the presenters as well. You don't mind, Dr. Badawi, right?
Of course, of course. Actually, my email is on the screen.
They can contact you directly.
The email is on the screen. Please, for everyone, feel free to contact me, whether through the Canadian Board of Aesthetic Medicine or directly by email. I would be very happy to answer.
Thank you so much. That was amazing. One more time, I would thank Clarion for arranging this these 3 presentations yesterday and 2 today. And then, of course, Dr. Badawi, like always, great information, amazing, most, I would say, up-to-date information you always provide for everyone.
Thank you.
Everywhere you go, and everyone is really appreciating that. So yes, so what I would say, we in about, I think, half an hour, if I'm not wrong, we will have the thread panel, about 20 minutes, and then everyone is interested to participate in that. You're more than welcome to come back. Thank you so much again, and have a great day.
Thank you.